And now it's Boomer Life. Lifestyle ideas designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation. This is Boomer Life.
AM 650.
A smile is just a frown turned upside down, my friend. So hear me when I'm saying smiling faces sometimes. Hey.
Not only are these two gentlemen that we have in the studio with us experts at what they do, you like to groove.
Yeah, that was a real nice song.
Smiling faces sometimes.
Yeah.
Yeah, that's what we're talking about today. We're not, implants, tooth implants, that's great. That's one thing. It's a byproduct. What we're really talking about here is lifestyles and smiles.
Yeah, and teeth.
Teeth.
People don't want implants. They don't want this and that. They just want to know, am I going to have teeth? Am I going to be able to smile well and eat and chew and feel confident about it? That's it.
It's quality of life.
My wife's grandmother, God rest her soul, years ago, and she's from England, so in England, after the Second World War, they got stuff for free, you know what I'm saying? She had a set of choppers that the dentist gave her until she had her permanent set come in. She had the temporary set until she passed on in her late 80s. Those were good teeth. However, we have to keep running to the store to get this Polident stuff and this Fixident stuff to keep them in place.
Yeah, you had to fill the gaps because the bone would wash away, and you had the spaces that you had to fill. They didn't work too well. They didn't fit too well, but you filled it up with Polident to hold them in place.
And then if you get it on your lips, you can't open your mouth, and that's no good. So this is a permanent plan we're talking about here today.
That's the whole idea.
Yeah.
How to return your mouth into that condition when you never had lost your teeth and they're all healthy and stable and felt good. That's what we do in implant dentistry.
So, again, let me be the devil's advocate. Somebody goes in, they have a couple of implants put in. I look at them. Can I tell? Unless I'm a dentist, of course.
In most cases, no.
Really?
Yeah, in most cases it'd be difficult for you to be able to tell.
That's interesting.
Yeah.
That is really cool.
It is really cool. It's completely changed dentistry. I had a patient that came in on Thursday, talked to him about it, and said, the implants have changed the way we do dentistry. We don't have to do partial dentures as much anymore. We don't have to do these weird-looking bridges. We can give you single teeth. It's amazing.
Bobby, give us your website.
It's bcperio.ca, bcperio.ca.
And Dr. Zokol?
Is Zokol.com, ZOKOL.com.
Now, I go to your website after the show. What am I going to find on there?
You're going to find a lot of photos and videos and the ways to contact us as well, and some examples of some cases as well. So a lot of information.
Lots of information. Oh, we have another caller on the show, do we? No. He says no. Shaking his head. I thought we did. I thought I saw a different address down there, but now I see. Oh, that's your address. Okay. So in Coquitlam, it's 250 1175 Johnson Road.
Yeah, Johnson Street. Yeah,
Johnson Street, and that's your newest location.
Yeah, that's the new office just outside of just next to the Coquitlam Center. Yeah, it's great.
So again, your offices are located where?
So we have one in Coquitlam. That's the newest one. It's on 1175 Johnson Street, right next to the Coquitlam Center. And then we have a brand new center right off of Broadway and Willow here in Vancouver. It's a state-of-the-art center. Its grand opening is, well, we're already open, but the grand opening is going to be May 13th, 14th.
And you won't be serving candies at that one.
Well, not candies, but there'll be a lot of stuff that you could probably, sweeten your teeth with. I think for sure.
I had a buddy that was a dentist said if you're going to eat candies, eat the sucky kind, not the chewy kind, like the pull fillets and that sort of stuff. And Dr. Zokol, but if we want to come and see you, where are you located?
We're located at City Square in Vancouver. It's 555 West 12th Avenue. It's right on the corner of Cambie and 12th Avenue, and probably about a block away from that SkyTrain station right at Cambie and Broadway.
Could I call ahead and make an appointment?
You can. And that's one thing you'll find on our website. You'll find our phone number, which is 604-322-3250.
Did we give your phone number? I don't think we
did. Not. Mine's pretty easy to remember. It's 604-872-0222.
Sorry, I forgot that. What was it?
604-872-0222. There you go. There you go.
I'm just a goof. You set me up for these things. I just
I
can't
know.
help it. I just can't help it. So you are really enjoying what you're doing? Your patients are enjoying it? You've always got room and time to see new patients?
Always. It's the lifeblood of what we do is our new patients.
And for people listening who might be considering doing this, they don't need to go to the regular dentist and get a referral, do they?
Not at all.
No?
Not at all. Just give us a call. Come on.
Yeah.
We'll come in
You don't need a referral to come in. We will work with your dentist if you'd like us to. Absolutely no problem. And a lot of times we do that. We want to work with our colleagues as much as possible, but you don't need a referral to come in and see us.
And if somebody would just like some regular things done, you can do that as well.
It depends on the regular things. There
Yes.
are things that general dentists do that neither Bobby nor I do, and we'll find you a general dentist if you don't have one.
Yep.
It's part of the service. That's quite nice.
It is.
Absolutely.
So you have people coming to see you from all over the place. We're going to go back to the phone lines right now. We have Jim on the line. Jim's from Richmond.
Ooh.
I think he may have a question for you. Good morning, Jim.
Hi, how are you?
I'm good, thank you. How's your teeth?
My teeth are great, but my wife's teeth are a problem.
I was going to say that. Your teeth look pretty good, but your wife, well, you know. Jim, you have a question for our doctors.
Anyway, she had a bridge put in about 2 years ago, right? And this bridge has been giving her nothing but trouble. She ends up with food underneath it. She ends up with aches and that sort of thing. Would it be better to get an implant as opposed to a bridge?
I would tell you that most times, what a bridge is in someone's mouth is we're missing a tooth between two teeth, and we end up shaving down the teeth on either side and then making one really big bridge that's one piece that sits on top of two teeth. Now, an implant we wouldn't have to shave down the teeth on either side. We'd be able to put an implant in and put the crown on, and I would say it's a standard of care. An implant will be better than a bridge almost every single time.
And I think, Jim, as well, is that right now for your wife, it'd be appropriate to find out why she's having the discomfort and see if that problem can be solved first before figuring out how to rebuild the actual tooth structure.
Well, apparently the food gets underneath the bridge and that, and she's forever flossing it to get relief.
And there's nothing you can do about that with a bridge. You can learn how to clean it. You can learn how to get underneath it. You can use a water pick and some different types of floss. But, there's always going to be more of a challenge to clean underneath the bridge versus having a single tooth implant there.
Okay, now if she used to get an implant, would she be better off getting the 3 teeth done as an implant, like the 2 that have been shaved?
Not necessarily. A lot of times we can actually just keep the same bridge that we have there and cut the tooth that's in the middle that's really got nothing underneath it out and just put a single implant in between the 2 teeth, and that will relieve everything that she's having issues with. But on top of that, allow us to keep the same crowns that she's already paid for on those other 2 teeth. And just because they're shaved down doesn't mean those teeth have to come out necessarily.
So it would basically relieve her pain somewhat as far as the food buildup underneath the teeth goes, or the bridge goes.
Absolutely.
Oh, perfect. Okay, thank you.
Thank you for your call, Jim. I appreciate that, and I hope you have a happy Easter. So
You too.
Thank you so much. So part of your job then, part of your quest is to save as many of the natural teeth that are healthy as you can.
Well, absolutely.
Always.
Absolutely.
Yeah.
I think people might think, too, they go to see a doctor such as yourself and the implants, that you're going to put the whole mouthful in there. You will if they need it, but if they don't.
No, not at all. In fact, if I have a choice of saving a tooth, my own tooth, or putting an implant in, I want to save my natural tooth.
Well, exactly. And I think there's numerous times people come in and say, Doc, I've got these lower teeth, just take them out. I want them out. I want it done with and all that. And a lot of times they're just frustrated with everything they've had to go through and all the things. And a lot of times those teeth are really healthy and they're in good shape. So why don't we do something so we can maintain the rest of your mouth, get you into a stable situation, and you can keep your teeth the rest of your life?
Do you ever say to people, they come in and say, I just take my teeth out and be done with it? Do you say, why?
All the time.
Do you really?
All the time. What's the problem? Why are you wanting these teeth out? When I look inside their mouth and do an examination, it looks great. A lot of times, there's luff bone, and yes, they need some fillings or some caps or crowns or something, but the teeth themselves don't seem like they're going to go anywhere anytime soon.
So when a person comes in to see you for their initial consultation, it's more than just talking. Do you actually look in their mouth at that point?
Oh, yeah. We do a full, thorough examination. We go through, take a bunch of readings, take a look in their mouth, and make sure everything's doing really well.
And time-wise, how hour?
We book about an hour for that consult. Sometimes it can be a little bit longer, sometimes a little bit shorter. Just depends on the case.
Sounds good.
Yeah.
Let me ask you, you're putting your finger up. Okay, I see what you're saying. He wants to go to the dentist now after this. He's never been before in his life. It's his first time. Let me just ask you a quick question before you go. You guys, I know you can advertise in the newspaper, the phone book. What made you decide you've been on radio for a lot of years, Dr. Zokol, but why did you choose radio?
Well, Ron got me into it. But
Did he?
but more than anything else, it's I just want to make sure people get information. That's my biggest thing to me is knowledge is power. And like I said before, is that if you don't know all your options, and there's so many people just go along their way without actually getting treated or getting something because not so much they can't afford it or they're scared, is that they just don't know. And that's the biggest thing, is you want to make sure everyone gets information and they know what's going on.
Before we go today, can we just get you gentlemen to give your websites one more time?
Sure, it's bcperio.ca. That's bcperio.ca.
And I'm Zokol.com, ZOKOL.com.
And Dr. Ron, if people want to call you, what's your telephone number?
604-322-3250.
That's good because usually you don't call yourself.
Oh, yeah.
That's true.
And Dr. Bobby, your number, the office?
It's 604-872-0222.
Okay. Congratulations. You guys are doing a wonderful job, and you've answered a few questions for our listeners. And I'm going to come down to your office. I'm not looking for implants right now, but I just thought I'd go want to hang out with you guys.
Yeah,
That's a
come on
great
over.
idea.
Can we do that?
Absolutely.
Okay, maybe get you back on the radio one of these days.
Sure.
Look forward to it.
We got nitrous.
Do you? I'm coming. I'm coming. Gentlemen, thank you so much. It's been fun. Dr. Bobby Birdie and Dr. Ron Zokol, I appreciate your time.
Thank you, Tom.
Have a wonderful Easter.
You too, absolutely.
I'll see you at your office.
Perfect.
Will do.
To our producer, Dwayne, we say thank you. And I'm back tonight at 6 o'clock with a worldwide retro rock request show. Great tunes from the 60s and 70s. You're going to call in, guys.
I'm going to have to.
Absolutely.
You have no choice. Enjoy your day. It's Tom Lucas. Talk to you soon. Thank you. Bye.